Thanks for the invite. I'm very happy to be here today. I think together with Thomas, who will speak later on from Oslo, I'm one of the few people from outside Glasgow, Scotland, UK. So I feel honored to be here. Today I'm speaking with, let's say, 2.5 hats on. So I represent my host organization, the Regenboog Group in Amsterdam. It's a low threshold service for people who use drugs, homeless people, people with mental health problems. And we also have a drug consumption rooms, or actually we run 3 drug consumption rooms. I'm always very proud to tell so. And we also host a European network called Correlation European Harm Reduction Network, and this is what I'm the head of. So this is the main activities I'm involved in. Scottish Drug Forum and Dave are one of our members. We have around 170 organizational members and 130 individual members, and we have focal points in 33 countries. And for Scotland, the Scottish Drug Forum is our focal point, collecting annually information at city level. The third hat, or the second hat I'm having, is that I'm the acting chair of the EU Civil Society Forum on Drugs. I will shortly address some issues on EU drug policy, talk about the role of civil society, and also about some challenges related to the implementation of a balanced and drug policy at European level, and then also come with some examples. The Civil Society Forum on Drugs is an expert group towards the Commission. It consists of 45 organizations representing different stances, so not all harm reduction organizations or networks, but also organizations in the field of prevention, treatment, and also not always having the same opinions about drug policy. However, we provide input and feedback to the European Commission when it comes to drug policy. We also have regular consultations with the relevant presidencies, and also with the member states, the Council, and the horizontal drug group, where we try to provide input in what is actually going on. So a good example is when it comes to the strategies, EU drug strategy and action plan. I just showed this overview. So you see, since 1990, action plans were developed. In 2000, the first strategy and action plan was developed. And only in 2007, the Civil Society Forum was formed. So logically, we could only provide input into the action plan from 2005 till 2008 and the following one. To say in the very beginning, our input was relatively low. It just changed in, I think, 2012 when in 2012 when the new drug strategy was developed. And this was the first time when we were actually really in a meaningful way involved by providing input from civil society organizations across Europe. And we were very much happy with the strategy itself and also the action plan. When we go to the next one, to the 2021 strategy, which was developed in 2020, something strange happened, because the Commission suddenly published a communication on the EU drug agenda without consulting nor the member states nor civil society. A roadmap was published, or an online consultation was published, where everyone can provide input. You can imagine that both member states, but also we as civil society, we were flabbergasted, because suddenly there is a document. Normally the Commission launches a document, provides a document towards the member states and the civil society, and input can be generated, and a final document will be compiled and will also be adopted by the member states. This was different this time, and interesting enough, the member states took action and actually said, we don't accept this strategy, Instead, we developed a new one, and they did much better. So they involved civil society forum with really decent input, with a result that in 2020 and in December, the strategy was developed under the German presidency. I think this was, I'm explaining this more in detail because I think there was a change in the Commission also, where we saw suddenly this positive change in the previous years somehow changed. A new way of working was established, which happily also was not appreciated by the member states. What you see now, I just wanted to show you the 3 policy areas which are included in the new strategy. It's not so much different from the previous one, but you have drug supply reduction, drug demand reduction, and also addressing drug-related harm. It's not called harm reduction, and you will see that, you also have cross-cutting themes and 11 strategic priorities. If you go to the actions addressing drug-related harm, there are quite interesting ones. You see drug-related infections, which is very good, which is currently more or less addressed in the current EU for Health program. Civil society is mentioned here, and also prison and aftercare. But you also see that restricted availability of drugs in prisons is mentioned, while this should be actually something which falls under drug supply reduction. And this is why I think our general understanding about what harm reduction is a different one, because harm reduction in our understanding also means that we address harms which are also coming from certain policies which affect people who use drugs. Looking to, again, to the strategy or the action plan, you see that there you can see that different implementers are mentioned. So you see for sure the European Commission, the Member States, which is the Council of EU, and also EU agencies. No, civil society is not mentioned as one of the implementers, while we see that in many countries the implementation of drug policies is very often delegated to civil society organizations. We also see, and this is that actually the funding directly changed in 2021. The previous program which funded drug-related topics in drug demand reduction, which was a very tiny project, but still it was important, was disappeared, and a new funding scheme came. So we have programs like the Internal Security Fund, and actually only funding in regarding crime prevention, law enforcement, drug trafficking. These kind of issues are currently addressed, and when it comes to drug demand reduction, no funding is available. So that actually means that also the strategy is balanced in terms of all the topics are being mentioned. When it comes to implementation, the Commission shifts all responsibility to the Member States. And I personally believe when it comes to the evaluation, which will come at the end, that we will see that drug demand reduction priorities, topics and activities are not being implemented. And this is also what we have constantly been addressing with the Commission. But in principle, they are shifting this towards the Member States and say this is the responsibility. When you look to the general role of the EU, because I don't want to do EU bashing, because I'm very much fond of the European Union, and I'm very much regretting that the UK left the European Union, and so it's clear. And we also see when you look to the global level, if you have ever been to the Commission on Narcotic Drugs, which meets once a year in Vienna, you see that the Union does have an important role and can play an important role in promoting an evidence-based, human rights-based and balanced drug policy approach. So I think this is still a very good thing. We also see that for new member states which were coming in, and for those who are still joining the Union, you see that such a drug strategy and action plan can be a very positive thing. New countries can use it as an example and hopefully also implement it in a more balanced way. Generally spoken, I think the EU stance is relatively progressive, but we also see that other countries have already passed them way out. Also not only in the European Union, but also in generally. So the EU is not an early adopter, but follows when it is needed. Also an important one, both positive but sometimes also a bit negative, is it is a watchdog. So you see to the rollback on human rights, and I think the examples for Hungary and Poland are good examples where the Commission said, okay, you need to apply certain rules and laws, and if you pass this, you will be sanctioned in one way or the other. Another example, which is probably a bit more unclear, is in how far progressive drug policy developments in the EU are being frustrated. It is unclear. Germany is an example. I will show it here. So Germany, some of you might know that they wanted to develop a more liberal cannabis law, which is actually still, they did it, but they somehow scaled it back from the original plan. No one knows what the Commission it's clear that they talked to them, and also the minister is saying that due to the discussions with the Commission, they decided to adapt the plan. But the Commission itself is saying that they actually did not really have any negative input towards this. Narrative, this is also what we see. While in principle we always say it is important that that people who use drugs are no further stigmatized and discriminated, we see that there is a changing narrative. I don't know if you know, but the Swedish commissioner, which is the commissioner of DG Home, she actually sat and blamed the users of drugs for the killings in drug crime. There was a young girl was killed in Antwerp last year, and she was blaming the users for it. Same happens in the UK, I think. So the middle class coke users, so the non-addicted ones, are being blamed for using and for supporting drug crime. And I was also, when I was at the CND at the beginning of the year, we followed a discussion at the UN ODC. The new cocaine report was presented, which announcing all kind of more crime, more criminality, more violence. And when someone said, wouldn't that be a moment to rethink the current approach and to think about how we can actually regulate the current market? We didn't, not even talking about legalizing, but decriminalizing and regulating the market. It was the head of the unit of DG Home who was saying, and this is actually, it's not a real quote, but it is something, even if the current drug policy approach does not work, it is no reason enough to change it. Legalizing drugs feels like a defeat. And I think this is something which clearly indicates it's not based on what works, it's not based on evidence, but it is based on the idea that we don't, or they don't want people to use drugs. So as a conclusion, I think still the EU is an important player and advocate for a balanced evidence-based and human rights approach. We see, unfortunately, that the implementation of the strategy is solely focusing on drug crime prevention, so there is a clear shift. No longer an early adopter of innovation, rather a late majority. And this is why I think that actually the experience at local and national level is so much more important, and that actually we should think it in a different way, that we still think European, but start to act local and try then to actually convince the European Commission again to actually change and make more progressive and evidence-based decisions in the future.